Today is Wellness Wednesday. Joining us for some medical hot topics are pediatrician Dr. Ali Naqvi, periodontist and implant surgeon Dr. Ralph Hanna, and internal medicine specialist Dr. H. Michael Ogburn. Good morning. Good morning. All right. We talk a lot about what we've done in space that benefits us in medicine, even like imaging, MRIs, all that type of stuff. But sometimes I think we overlook the simplest things. So I'm going to see if you can figure out what was happening to me with me a few months ago. I would wake up in the morning, every joint was aching. I would ache right here in the middle of my arm, here, my finger, everything. Oh. And I kept thinking, this could be an autoimmune disease. Don't go on WebMD because you'll have like, I had everything from 15 minutes to live to, whatever. And I kept thinking, what is it? I went to get an infusion. I thought maybe I need some vitamins and some minerals, and I blew 5 veins. So what was happening?
Oh, so you were dehydrated.
I was dehydrated. And the crazy thing is I realized I was really not drinking water. And so I drank 3 bottles of water, and after months of aching, to the point where actually a doctor said to me, we probably have to do surgery on my knee, it was hurting so bad. I drank 3 bottles of water and fine. Everything's been fine for the last few months. So something as simple as water remind us of why we need to do this.
Exactly, and particularly this time of the year when it is so hot and humid, it's easy to overlook it. But we see it all the times, like just getting dehydrated. So something as simple as just taking your water regularly can fix a lot of things.
Yeah, and when we say water, Dr. Ogburn, we don't mean water by the way of a Coca-Cola, right? Or water by tea or coffee.
Exactly, because within tea and coffee and the sodas, there's caffeine, which acts as a diuretic, which is going to further dehydrate you.
Yeah. Yes. Yeah. All right. So like water can't be construed as like maybe Chardonnay.
Yeah, there you go.
Yeah. No, when you say water, we mean water. And I promise you drink the water and things can change. So if you're waking up with all those aches and pains, you don't think it's something else, drink water and see what can happen. Okay. Dentists are noticing cavities and tooth damage in patients who vape. Vaping, as we know, is kind of the whole new thing, and I think research really hasn't told the long story yet, but we certainly know many things. So let's start with you, Dr. Hanna, on the impact of vaping on the mouth, just like we know like chewing tobacco and cigarettes can have.
Yes, so that's the thing is that it's new. So the problem is that science takes usually studies of 10 to 20 years follow-ups to kind of start making evidence that this causes this.
Yeah.
When it's something that new, we cannot, or we do not have a scientist or someone or a study or a long term that can tell you, yes, we found out that it's will hurt you or will do this. But there's also the common sense. You're using something that will cause you dry mouth, that have chemicals that cause vasoconstrictions to the blood vessels and the cell turnovers. So we know it's damaging.
Yeah.
We can't just prove it yet. So, but the dry mouth, we know the damage of a dry mouth. Cavities, gum disease, because our saliva causes the bacteria to get washed and have immunity factors to kill the bacteria.
And it can lead to loss of teeth and the whole
So when you have a dry mouth, you're causing the bacteria to grow kind of like in a safe oven that's keep growing and multiplying.
Yeah.
The other thing is that the carcinogens that are in the same materials, the same chemicals are present still.
Yeah, in fact, Dr. Ogburn, there was someone I heard the other day say that they had so much trouble quitting cigarettes. And so they said the e-cigarette was the best thing ever because they could like use that now and it helped them to quit using cigarettes. Well, the point is you just basically transferred a different method, right?
Nicotine is nicotine.
Yeah.
And whether it's in cigarettes or vape, and nicotine is one of the most addictive chemicals.
Yeah, and you work in the area of addiction. We'll talk about a little bit later, but when the person said that they could not put it down, in fact, they would have a panic attack if they didn't have their vape pen in their hand or in their pocket, and that's kind of one of the indicators that there may be an addiction present.
Yes.
All right. Well, the other thing that's so crazy, Dr. Naqvi, is that kids are using this stuff like crazy. You see them all over the schools. I don't care what school you're in. Teachers are like, kids have like, all these vaping like jewels in their backpacks and stuff. And so for children in particular, is this something that they should be concerned about?
Yeah, definitely, because it's more like a trend now. So like it is something which is popular, so everyone wants to use it.
Yeah, well, you have bubblegum flavor, pancake flavor, all that, blueberry, all that type of stuff, yeah.
Exactly, and a lot of them don't even see it as a cigarette, so, but it does have nicotine, it has the same effects that the cigarette does. Yes, the concentration of nicotine is less, but it is still nicotine.
Yeah.
So, and maybe 10, 20, 30 years from now, that's when we will start learning so what it has been doing to these kids.
And what we know through research is when you do things on younger bodies, sometimes the impact can be greater.
Yes.
Okay. There's a spike in tooth decay among kids, and the dentists are urging parents to teach their kids to, what do you think they're teaching kids to do? Brush your teeth, right? We're not even talking about flossing at this point, right? Brush your teeth. It seems that we kind of have forgotten about that. And I know I've caught my son, like I'll say, did you brush your teeth? Yes, and I would, let me smell. Let me smell, right? Because it's like, they're like, for some reason they feel like it's such a big chore.
Well, the issue we're finding is that the parents are thinking that, you know, if you showed your kids like once or twice how to brush your teeth, they got the hang of it and they can do it. Yeah. The problem is most kids will brush just their front teeth and they just can't.
So those are the ones you see, right?
Yeah,
so I'll keep
they're
those.
easy to get to, but it requires certain dexterity that the manual motion is not there yet for a 6 or 7 year old. So you have to be present when they're doing it. And to develop a habit, it takes 20 to 30 days of continuous doing it twice a day. When you find that they have developed the dexterity and they can reach, like hard to reach, even adults, I get all the time people that just brush the same areas every day.
Yeah.
Because usually you're not thinking about it and you skip the same thing every day.
Yeah.
And that's when you'll have that cavity or you'll have that pocket and you'll have that inflammation. And so, you know, brush the ones you want to keep. Right?
Yeah, exactly. Only the ones you want. That's the rule in our house. Just brush the ones you want to keep. Okay. This next topic: British boys will receive HPV vaccine to prevent thousands of cancers. We know HPV. It caused a lot of controversy in the beginning when our governor said, "Okay, I want girls to get this vaccine." But in Britain, they're saying also the boys. Now, here's the deal: it can be transmitted sexually. Some of the cancers and things we're talking about. But people got confused and thought, "No, I'm not encouraging my child to." One day it may happen. I know you don't want to believe that. One day when your child is 40, they may actually find someone, right? But the point is that we have proven that this can help prevent certain cancers. So again, boys will receive this HPV vaccine to prevent cancers in England. What about here?
Yeah, so it's I think it's a great move because HPV doesn't distinguish between males and females. So it does cause cancers both in males and females. So in fact, like at a certain time, so right now, so there are about 80 million Americans which are infected with HPV virus. And every year we see about 40,000 new cases of cancers related to HPV. Wow. And out of those, approximately like 14,000 are in boys. And 95% of those cancers in boys, they can be prevented with this vaccine.
Okay.
So if there is, so it's a cancer preventing vaccine which is proven safe and effective. So we have seen that it has been extremely successful. We have been using it in, so girls have been mostly getting it until now, and we have seen like more than 71% decline in HPV related infections.
Already, yeah. So. Okay. Dr. Ogbert, in the area of treating addiction, they say exercise is helping extreme athletes and others in Colorado to battle addiction. So, I think a lot of people think that just the whole addiction thing is just stop. Right? Do your detox and just stop. There's a whole lot that goes into, and we'll get more into your segment in a minute. There's a whole lot that goes into it, but exercise we think of as just losing weight or maybe getting our heart healthy, but it does a lot of other things too.
It's actually been shown that exercise, now it doesn't have to be extreme exercise like they're doing in Colorado. Even 15, 20 minutes of walking, okay, actually boosts certain neurotransmitters known as dopamine and serotonin. And these are pleasurable neurotransmitters. Yeah.
Some things that drugs may have given some people,
absolutely.
So you replace it with something healthy.
And even at our treatment center, we encourage yoga, and we have a gym, physical exercise, encourage the patients to play basketball, volleyball, anything to increase exercise, increase the release of dopamine, and help them over their cravings.
Yeah, because it's amazing, because I have a friend who went through rehab, and she said it was amazing what the exercise did, because what the drugs did was she couldn't get happy anymore. She kept saying, I can't like smile, I can't get happy. And what replaced it for her was not another drug, it was exercise.
Exercise.
All right, very interesting. Well, gentlemen, thank you very much.